All right, it's 6:45. I'm going to paint a scenario for you here. Let's say you have medical insurance, and let's say you go to the emergency room. You would assume at that point that you're covered, right? That's not necessarily the case.
A KGW investigation found patients in Washington are getting hit with surprise medical bills that aren't covered by insurance, even though the hospital is in network.
Investigative reporter Kyle Laboshi joins us in studio this morning with more. Kyle, this is scary.
Indeed, this is an issue we've been reporting on for quite some time. In fact, earlier this year, Oregon lawmakers closed the loophole. It can't happen anymore, but not Washington.
I've been having really bad chest pains and stuff, and they can't figure out what's going on with my heart.
After visiting her regular doctor, Patricia Bunn got an alarming phone call. Test results showed she was at risk for blood clots and needed to get to the emergency room right away.
You're sitting here, oh my gosh, what the heck's going on? What's wrong with my heart?
Before leaving for the hospital, Patricia's husband called their insurance company seeking direction.
Yeah, because I'm going, well, which one do I go to? You know, Peace Health or the Legacy? And they said, go to Peace Health. That's the one that's covered and in network.
Emergency room doctors at Peace Health Southwest Medical Center examined Patricia. After a few tests, she was released from the Vancouver hospital. The couple paid the hospital a copay, and insurance covered the rest. They thought they were covered. Until a few weeks later, when a separate bill showed up from a medical group Patricia and her husband had never heard of, Emergency Medicine Associates, with a post office box in Los Angeles, California, demanded $693.
You know, and I'm going, who are these guys?
Turns out one of the doctors that treated Patricia in the emergency room wasn't covered by her insurance, even though the hospital was in network.
I had no idea. They did not say anything until the bill come. I think it was like 30, 40 days later.
The practice is called balance billing, and here's how it works. When you go into a hospital, you may be treated by a doctor who accepts your insurance. But if somebody else comes in to help you who isn't in network, the patient is likely to end up with a separate bill from that provider.
Joe, people are frustrated, and rightfully so.
We've reported on this issue extensively, and in March, a new law went into effect in Oregon protecting consumers from these surprise out-of-network medical bills. But in Washington, there's nothing to stop balance billing. It's perfectly legal.
My opinion, people's losing money. They're getting ripped off.
Washington Insurance Commissioner Mike Kryler believes consumers shouldn't be caught in the middle of billing disputes. He's proposed legislation to stop surprise medical bills.
We should be able to figure it out.
Although previous efforts have failed in Olympia.
You got the providers, the hospital and doctors on one side, you got the insurance companies on the other side. Hey, you guys go fight it out, but get the consumer out of it.
In a lengthy statement, Peace Health said in part, it's working with other healthcare providers to ensure that insured patients seeking care in qualified emergency situations are covered at in-network rates for any and all services received. But Patricia and her husband, they're still stuck with a huge bill. Emergency Medicine Associates initially offered a 30% discount. But when the Washington couple explained they wouldn't pay,
it's very, very tight budgets.
Emergency Medicine Associates sent Patricia to collections, demanding the full $693.33.
It's not right.
And for Patricia, this nightmare, it just drags on. First, she got a letter from collections saying she didn't owe. Then, a day later, she got a bill from Emergency Medicine Associates indicating she did. So we tried to reach out to this medical group for clarification. They never answer our question.
Now, you talked about Oregon had this problem too. They have since fixed that, but what about Washington?
So the insurance commissioner in Washington wants to change that. He's going to introduce some legislation coming in January, so hopefully they can close this loophole.
You're talking about January. What about in the meantime, like Patricia, for instance? You shared her story. What can she do?
You know, as a consumer, you've got to be your own advocate. You've got to fight for yourself. When that bill comes, look through it closely. If you live in Washington, you can, speak up. Talk to your lawmaker about this. They've closed that loophole in a lot of states, including Oregon, many others, but not Washington.
Our viewers are speaking up. In fact, you have some comments right there, Brenda, that you can share right now with the rest of the gang.
Absolutely. So these were from our Facebook page, and we ask, has this ever happened to you? Viewer Susie Hyatt writes, yes. Heart surgery out of network. Can you imagine? No follow-up care. Had to find all new doctors while recovering and trying to figure out what I could or could not do. Not fun. Extremely scary. Surgery in May, still waiting for follow-up care. Oh, we wish you well. That's a tough one. Also, Christina Buys, one of our viewers, writes, yep, when I had my daughter, the doctor that had to deliver wasn't covered by my insurance, even though the hospital was. And viewer Serena writes, yes, ER physicians are not always contracted the same as the hospital. If you try to confirm, you get the runaround. It's terrible. So if you have a story idea for Kyle to investigate, please give him a call. The phone number is there on your screen. It's 503-226-5041, or you can email callkyle@kgw.com.